Welcome everyone to our first podcast of a series of podcasts being aired for Gambling Harm Awareness 2020, funded by the Gambling Rehabilitation Fund on behalf of the South Australian Government, PsychMed and the Wellbeing Recovery Institute. Firstly, before we get started, I'd like to do an acknowledgement to country. We would like to acknowledge the traditional owners of the land we meet on and pay respect to elders, past, present and emerging. Here today, we have Dr. Alex Russell of the Central Queensland University, Dr. Jane Oakes, who has recently lectured at Flinders and Monash University, and Dr. Quinton Black from the University of Adelaide and the University of South Australia. Thank you, Dr. Russell, Dr. Oakes and Dr. Black for joining us today. We really appreciate your time. Today's discussion will focus on online gambling and COVID-19. To start with, I'll introduce our guest speaker and panellists. First, we have Dr. Alex Russell. Dr. Russell is a senior postdoctoral fellow at the Central Queensland University, Australia. He has worked in gambling research since 2011, studying various topics, including internet gambling and social media use by gambling companies, gambling-related stigma, gambling inducements, promotions, and direct messages from gambling operators, sports betting, impulse betting, gender differences, gambling in Indigenous communities, and social influences on gamblers. His other research interests include taste and smell, particularly wine perception and synesthesia. Then we have Dr. Jane Oakes. Dr. Oakes is a program facilitator at PsychMed, the largest community-based provider of mental health and addiction services in South Australia. She has previously held multiple senior positions at addiction treatment organisations and has extensive cognitive behavioural therapy experience and has completed her PhD on relapse in electronic gaming machine gambling. And finally, we have Dr. Quinton Black. Dr. Black is a medical practitioner, clinical psychologist, educator and researcher. He is the Program Director at PsychMed. Dr. Black has worked for 38 years in mental health and addiction as a counsellor, psychologist, educator and medical practitioner. He has run multiple programs for problem gamblers in South Australia since the early 1990s. He is also a senior clinical lecturer in psychiatry in the School of Medicine at the University of Adelaide and a senior clinical lecturer in psychology in the School of Psychology, Society and Justice at the University of South Australia. Welcome everyone. To kick things off, we'll start with Dr. Russell. Can you describe what online gambling is, how prevalent it is, and how it differs from other forms of gambling? Is it more or less harmful?
Sure, thanks for having me. All right, when we think about online gambling, a lot of people think of it as a type of gambling, but the way that we tend to think about it, the team in the Experimental Gambling Research Lab at CQ University, is actually a way to access gambling rather than a whole separate form of gambling. So let me give you an example. Think about sports betting. You used to have to be pretty organised to place a sports bet. You'd go and take your cash out, wander off to a facility. It could be a TAB retail shop. It could be a bar that has a betting facility. It could be a bookmaker somewhere, and place a bet. So, it took time and it took effort to go and place a bet. You could bet on a telephone, so you would open an account with an operator and place a bet by making a call and saying this is what I want to bet on and how much. So you could at least do that in the comfort of your own home. These days, of course, everything has moved online. We do all of our shopping online, and much is the same for certain forms of gambling too. So, you can place a sports bet on a website, and of course there are apps these days too. And this means you don't have to wait for a venue to open. You don't have to deal with somebody over the phone. You can just place a bet anywhere, anytime. And there's a bunch of different operators around as well, so you can sort of choose between them, whoever has the best specials or the best prices, which is something that's a bit different to land-based gambling. So in Australia, we actually have fairly protective online gambling laws. The only types of online gambling that the Australian operators allow you to bet on are sports and race betting, and also some other things around there. So things like betting on the weather or what colour tie a certain politician's going to wear next time he has a meltdown, those sorts of things. But and the only other one is buying lottery tickets, and Keno has recently gone online too. But we don't have, for example, online pokies or online casinos that are hosted in Australia. There are online casinos and online pokies overseas, though. So overseas, you can play online poker or play roulette online for real money, and we just don't have that in Australia. So we're a little bit different from the rest of the world in terms of this online gambling. But also, we're a gambling nation. We are the biggest losers worldwide. We lose more than per capita than any other country, far and away. And online gambling is a part of that because we can gamble so easily on lots of things. A few years ago, at the start of the decade, 2010, 2011, we did a prevalence study on online gambling in Australia, and it was about 8.1% at the time of Australians had placed at least one bet online, right? Whereas we know that that's increasing. We're currently completing the follow-up to that, so a subsequent prevalence study, and we'll have a new figure out in early 2021. But we've also seen other studies that maybe aren't as rigorous as our fantastic work that have shown a rise in online gambling over the years. And much of this is driven by the ubiquity of smartphones and smartphones getting easier to access to. So we know that online gambling is on the rise. Is it a problem? It's a tough one to answer. So there are some people who only bet online and only bet on sports and races. And, you know, there are some people in that group who are experiencing some problems. There are a lot of people who only ever gamble in venues, so on pokies and things like that. Pokies are, you know, far and away the most dangerous form of gambling. There are some troubling aspects about sports betting and race betting in particular, but pokies are the big issue. So what we actually see is the people who are experiencing the most problems are people who gamble in venues and online, because it's another way to access. So they might go and, you know, place a whole bunch of money through a pokey, the venue closes, and then they go home and it's like, well, I'm not quite done yet. I'll place a few more sports bets and race bets and see what happens overnight. So there's a bunch of issues popping up there, a way of accessing gambling compared to venues, and it has some good things about it in that we're a little bit more restrictive in what we allow online, and we don't have the most dangerous form, pokies, online in Australia, but there are some bad things about it too. So things like paying on your credit card is a very common way to get into your accounts. And that's expensive because you get charged as a cash advance and no interest-free days and higher interest rates. So there's bad things about online gambling too.
Thank you, Dr. Russell. That's a great overview. I think that really gives listeners a really good overview of the scope of the issue here in Australia. And it's great that you've also touched on sports betting, as that will be the topic of our next podcast, which will look at that in a lot more detail. Could you speak to how you know that we can best reduce these harms?
Sure. So in venues, one of the challenges there is that you're generally pretty anonymous. So if you go and play a pokey, it's cash-based, right? You just put cash through a pokey and no one's really following you and watching how much you bet. The staff in the venues are meant to have a bit of an eye on you and make sure that you're not causing too much harm to yourself or others. But, you know, we know that there's only a certain amount that they do in terms of interventions there, and that's a tough job on staff too. So, you know, that's a very anonymous way of betting, and it's really easy to sort of fly under the radar. With online, you have an account with the operator, so they can actually track you over time and see what you're doing and potentially intervene if things are going wrong. Now, none of them do. That's one thing that we would love to see potentially coming in is more proactive interventions from online wagering operators when, you know, expenditure gets ridiculously high. But of course, you can just go to another online operator, just the same as if you get cut off at your favourite pub where your pokies are, you can just go to the one down the road and, you know, no one's the wiser there. So there's that issue about consumer protection there in terms of, at least in a venue, people can see you going to the ATM over and over again, whereas online, you know, the tracking of your account there is not something that they necessarily keep an eye on too much, unless they're looking for things like fraud or those sorts of things. So that's one thing that could certainly come in. If we can work out a more central system of things like self-exclusion, or even have the operators talking to some central system that keeps track of play, so you can rule out that idea of just going to the next operator to place more bets if you get cut off, then that would be a fantastic way to help reduce limits, but that requires some cooperation from the operators, which is always a bit tricky. The other types of things that have started to be brought in are things like limits. So a lot of online accounts now have, say, the ability to put a limit on how much you deposit into your account. So you can say, in this month, I only want to deposit $100. And once you reach that limit, you can't deposit any more. Now, we know that a lot of people don't feel the need to use these limits because they feel that they have their gambling under control. And that's, understandable. There's a bit of a stigma about putting a limit on your gambling if you don't think that you need a limit. So there's a bit of a barrier to entry there because they're currently voluntary. But there's plenty of other things that could be brought in on the online space too. So changes to the way things like self-exclusion work. If you want to take a break, there's currently minimum periods on self-exclusion. It's usually quite a few months. So that's a really big step to take to cut yourself off if things are going a bit wrong. So bringing in sort of a shorter term self-exclusion limit, for example, could be a good one to look at too. I think the gold standard that we could bring in would be something like a central system that can link your online gambling to your venue-based gambling. And at least then an overall track record can be kept of what you're doing and more proactive interventions if things are starting to go a bit off track. But, that's a really difficult thing to bring in because there's, of course, a balance with people's privacy around those issues too. So, that's certainly something that a lot of people wouldn't feel comfortable with. But having said that, in terms of the damage to the community that comes from gambling, it would be fantastic to reduce it in some way. And that would be a pretty powerful way to do it.
Thanks, Dr. Russell. That's given us a great overview of some of the potential harm reduction possibilities in the future, as well as an idea of some of the barriers that are currently faced. It would be really great to see that gold standard linking the online and venue-based gambling via a central system and to have more of that proactive intervention. We will move to Dr. Black now. Dr. Black, what lessons can we learn from overseas studies and media with regards to the impact of COVID-19 on gambling?
Thank you, Megan. One of the things that has been most concerning have been some of the media reports during the COVID-19 period in Australia. In June 2020, the NAB Analysis of Consumer Spending reported a 50% increase in spending on gambling this year. There was also reports in the ABC about two major UK-owned bookmakers who reported large increases in profits of up to 330% on revenues. This is particularly interesting because it comes about on a background of stricter regulations being introduced in the UK and some of the providers over there looking to enter into the Australian gambling industry. Some of the key factors that underlie these increases are some of the environmental things that relate to COVID-19, the periods of lockdown and increased social isolation, a decreased access to electronic gaming machines, new UK gaming restrictions, as we mentioned, increased JobKeeper allowances and job seeker payments, access to early superannuation has raised some concerns. It has been estimated that by Alpha Beta research in August 2020 that up to 15% of money is accessed through early super access has been spent on gambling. So that was reported in the Sydney Morning Herald in the 4th of August 2020. So what do we know from actual studies? The Australian Institute of Family Studies, Australian Gambling Research Centre, published a new report in October 2020 on gambling in Australia during COVID-19. They surveyed over 2,000 people with known problem gambling diagnoses in the past, and what they found was almost 1 in 3 people surveyed had signed up for new online betting accounts during COVID, and 1 in 20 had started gambling online. Even with limited access to venues, overall, participants gambled more than during COVID-19. The proportion who gambled 4 or more times a week increased from 23 to 32%. Horse racing and sports betting, greyhound racing and lotto were the main products that participants gambled on before and during COVID-19. We'll be looking at this in more detail next week. Of concern, 79% of participants were classified as being at risk of or already experiencing gambling-related harms. Young men aged 18 to 34 were the subpopulation most likely to sign up for new online accounts to increase their frequency and monthly spending on gambling from around an average of around $687 to $1,075 during the COVID period, and to be at risk of gambling-related harms as a consequence. Key experts noted that the temporary closure of pokie venues had an immediate benefits for some people who gamble, including more money for essential items and increased savings. Around half of the survey participants reported that their physical or mental health had been negatively impacted during COVID-19, creating more pressure and impetus to engage in maladaptive coping behaviours such as online gambling. Survey participants and key experts recommended a large range of initiatives to minimise gambling-related harm in the community, including a reduction in the availability and marketing of gambling products and the implementation of strong consumer protection measures. And this really brings us back to policy and government and how can they best respond. During the COVID-19 shutdowns in Ontario, the rates of online gambling increased to 32%. 68% of those reporting online gambling stated that emergency measures and isolation had influenced their decision to commence online gambling, a finding consistent with the Australian survey and reports. Online gamblers had significantly higher prevalence of moderate and high-risk gambling. For example, 14.1% in the moderate and high-risk category for traditional gambling venues, compared with 21% in online gambling formats. There were higher levels of reported anxiety and depression in those of cohort engaging in online gambling. Approximately 60% of those with moderate anxiety reported gambling online in the 6 weeks following the declaration of emergency measures. Again, pretty consistent with the Australian findings. Moderate and severe anxiety were key risk factors for high-risk gambling. 1/5 of those reporting symptoms of moderate anxiety, around 18.3%, and severe anxiety, around 19.2%, were high-risk gamblers, which reflected over 3 times the risk relative to lower levels of anxiety. So, gambling was also affecting people's, and the isolation was also affecting people's drug and alcohol use, which was also correlated with increased online gambling and mental health concerns. So some of the impacts they found were people who were smoking, nicotine use rates went up from 43% to 87.5%. Caffeine use went up from 30.7% to 78.3%. Reported alcohol use or misuse went up from 40% to 68.7%, affecting people's capacity to make good choices and informed judgment. Reported cannabis use also increased from 48.7% to 83.6%. So we can see that across the board, stimulants, alcohol, depressants, and cannabis were increasing by around 40 to 48%. One of the other impacts that was quite significant was looking at the responses to what motivated people to engage in online gambling and increase gambling behaviours during COVID. 30% in the Canadian study indicated they wanted to win money. 37% indicated they were doing this for fun or excitement, 25% in response to boredom, 26% in response to their emotions, depression and depressed feelings, 8% as a form of escape from the stressors that were confronting them at the time, and 10% worryingly indicated they were wanting to earn income through gambling, which put together with the 30% to win money is quite concerning. And also the old chestnut of 8% chasing their losses as a motivation to continue engaging in gambling during isolation. So as we can see, there were quite a few important findings out of these studies, which we can use to help inform the way we work with people and the way we proceed to try and lessen the impact of COVID-19 and restrictions and isolations on the uptake of drug and alcohol misuse and problem gambling.
Thank you, Dr. Black. Those are some interesting statistics to consider. Could you talk about how we might be able to lessen the impact that COVID-19 has had on gambling?
Thank you, Megan. Look, I think in order to effectively reduce harms, we need to focus on the impacts of social isolation during COVID and look at some of the motivations for increased engagement in online gambling. So we know that social isolation in general terms has a negative effect on people's affect or mood and is often associated with increased depression. In the case of social isolation during COVID restrictions, we know that it resulted in decreased opportunities for exercise, increased relationship discord, increased depression, increased use of drug and alcohol as a coping strategy, increased stress and frustration for people. And we know that boredom was one of the key motivating factors, and stress and mood to engage in online gambling during COVID isolation. So how do people cope with these stressors? Well, often they'll turn to old, well-learned patterns of behaviour that assisted them in the past to cope. And one of those, in the case of people who have a background of problem gambling, may well be the use of problem gambling to escape some of their feelings of frustration and loneliness or boredom. And it may be reignited in a different way through online gambling rather than traditional gambling formats. So one of the things we've been talking to our clients about, and I think is an important way to help people combat some of these impacts, is healthy isolation. And there's 5 steps that I think are very important. The first is encouraging people to maintain regular routines. So, for example, getting up at the same time every day, having a shower, brushing your teeth, having a healthy meal, these sorts of traditional things that people routinely do. The second one is to continue engagement in scheduling and balanced activities. So to make sure that even though we're in a new environment with limited opportunities, that we ensure that we do things that give us a sense of achievement and accomplishment, goal-directed activities. We engage in a balance of activities that involve pleasure and fun and enjoyment, that we continue to engage in exercise, and we take the 3 R's very seriously. We engage in regular rest, good sleep, relaxation in an active and passive sense, and respite, making sure that we try and do things that break that pattern associated with the boredom. The third one I talk to people about often is social connectivity, and I think this is very important in 2 ways. One is to think about people that we know who might be living by themselves, who may be socially isolated and need some support and could benefit from you contacting them. Secondly, is for people who are living alone and quite socially isolated to ensure that they find new ways to engage with other people, ringing people up, having video calls with friends, these sorts of things that can be really helpful. The fourth thing I talk to people about is maintaining a healthy lifestyle. And there are 3 critical factors: good sleep, plenty of rest, good healthy nutrition, exercise on some sort of daily basis, and also you might throw in something like regular meditation or relaxation exercises, as we mentioned before, even just simple meditations in the morning about what I'm going to do for the day, what my plan is, at night, how did my day unfold, what things am I grateful for, what could I have done better, this sort of self-reflection. Finally, I've been encouraging people to think about the ways that they bring enjoyment and feelings of competency to their lives, and to use this as an opportunity to turn isolation around and use it as an opportunity to engage in some online learning, to maybe learn a new skill or develop a new interest or a hobby. As we know, there's a wealth of information on the internet now. Anybody can YouTube how to learn Tai Chi or yoga or Pilates or learn a new language in 5 days. All of these sorts of things can be really interesting and help promote a sense of coping that enables people to feel more in control in terms of their isolation. So these are some of the things. I mean, obviously there are lots of different things people could do and that we can do at a systemic level through government policy and as was mentioned in the Australian report. But these are actions that individuals can take to minimise the impact and harms associated with the social isolation through COVID-19 health policies.
Thank you, Dr. Black, for those tips. They're certainly very relevant as we continue to live with the impact of COVID-19. Dr. Oakes, we'll come to you now. Would you be able to enlighten us with any of the more recent research in Australia regarding COVID-19 and gambling?
Thank you very much for this opportunity to talk about this very important topic. The latest research, just to build on Dr. Black's research that's come out of Australia, that was produced by Gambling Research Centre and conducted by Rebecca Jenkinson and her team, has found some interesting findings. They actually examined over 2,000 people who gambled in this report to see how they adjusted changes because of the gambling availability that changed from hotel restrictions. What they found was that 1 in 3 participants signed up for a new online betting account and 1 in 20 started gambling online. Even with limited access to venues, these participants gambled more often during COVID-19, particularly on horse racing, sports betting, greyhound racing and lotto. These were the main forms of gambling reported. And of concern was that young men aged between 18 and 34 and these people were likely to sign up for new online accounts and increase their frequency and monthly spending on gambling from about $687 to about $1,075. And those who gambled and during this time, those who gambled 4 or more times a week increased their gambling from 23% to 32%. And 79% were at risk of already experiencing gambling-related harm. And half of the participants in this study suffered impacts on their mental health as a consequence of their gambling. What's interesting, though, is that the older age group reduced their gambling during this time, and the temporary closure of pokie venues had an immediate benefit for some people who gambled, including having more money for essential items and increasing their savings. What the people recommended in this study was, though, that people be encouraged to seek help using teleconference facilities. And I'd just like to say from my experience is that during the COVID shutdowns, particularly in Adelaide, that people were able to save. But unfortunately, once the venues opened, it was like the floodgates opened and people were really seeking help because they were distressed because they had gambled a lot of this money they'd saved. And what we know is that when people have access to large amounts of money and the opportunity to gamble, often their ability to make critical and informed decisions is lost. And what happens is they sort of convince themselves that they can afford to gamble and use money that they really can't afford. And that kind of thinking patterns is what starts that vicious cycle of gambling once again. And it's really important that these people are encouraged to seek help, to help them to reduce these impacts and to be able to eliminate the urge so they can make rational decisions about whether or not they can really afford to engage in gambling.
Thank you, Dr. Oakes, for outlining those recent findings. I think that has given listeners a good understanding of the impact of COVID-19 restrictions and reduced access to venues on gambling here in Australia, as well as the different impacts on older versus younger age groups during COVID-19. Could you now speak to how we can best engage people who are experiencing harms of online gambling more effectively during COVID-19?
Well, thank you very much. So I'd like to draw on some work that I did when I was in Melbourne with my colleagues, Associate Professor Victoria Manning, Professor Dan Lubman and Dr. Simone Rodder. So what we did was we did some research looking at how we can best engage people who are struggling with gambling-related harms. So what we found was, as we know, we really need to break that cycle of gambling and encourage people to seek help and to actually, when they do seek help, to continue the help-seeking process, because we often only have that one opportunity to engage people. So we need to make sure that when we do engage them, that we do it properly. And so when people do seek help, we know that it's often driven by a crisis and that they are distressed. And the problem when people seek help when they're distressed is that they can't really think carefully about their options. So we really need to make sure that when they do seek help, that we do reduce this distress so they're more likely to make help-seeking choices where they're likely to keep going. That's the right choice for them. Because often they have no idea about the help-seeking options available out there. And we need to make sure that these help-seeking options are easy to find online, because this is where the people are actually gambling and likely to seek help. When people do seek help, it's really important that we do normalise this, because it does take a lot of courage for them to reach out for help. So it's important that when they do reach out, that we just take a moment to congratulate them for the courage that it did take to seek this support. And we want to make the most of this opportunity when they do seek help, and just sort of really take a moment to ask them, why did you seek help at this particular time? Rather than actually asking for a full confessional about all the harms they've experienced, because if we do that, this is likely to increase their distress. And what we know, one of the biggest predictors of gambling relapse is negative emotions. So we don't really want to encourage people to become distressed when they seek help. So what's a really good way to do it is to give them hope and provide some stories of recovery, that when people do engage in evidence-based treatments, that we can actually get them better and they can stay well. So, for example, we can eliminate that urge. We can help them maintain critical thought so that money does have value and their life has value outside of just gambling. And also another important factor is when we do make a help-seeking environment for these people, it's important that it's not triggering, that there's not big gambling signs or pokey signals that trigger people to want to gamble. We need to make it really approachable, non-stigmatizing, and we normalise people's distress so that they feel that they can engage in help seeking and not feel shamed by the language such as problem gambling.
Thank you, Dr. Oakes. I think those are some really important considerations, particularly for any listeners who are involved in engaging people who are experiencing the harms of gambling. For the last segment of this podcast, I'd like to bring us all together for a panel discussion on future directions, protective factors, or effective treatments. So, to start it off, can anyone speak to what is some of the evidence for assessing people who may be experiencing the harms of gambling?
Thank you, Megan. I guess it's important to help healthcare professionals understand how to screen simply and how to use language of engagement that will facilitate better engagement with treatment services as a starting point. So one of the things that we often use as a simple screen is asking people, are you losing more money than you can afford to? It's the first question on the PGSI, and research by Turning Point in Victoria and Victoria Manning identified a very strong correlation, over 90%, with a positive answer to this question and the incident of problem gambling. So that can be a very good starting point for a GP or a counsellor working with somebody. Of course, as Jane will talk about in a moment, it's very important to meet people and engage with them in a way that reinforces and supports their approach to talking about these issues. So we know that there's often a lot of stigma and guilt associated with problem gambling and some of the impacts, and a reluctance for people to face those and acknowledge that to others. And so, it's very important to talk to people in a way that enables them to feel comfortable in engaging. And so, for example, perhaps talking to someone by at first validating and acknowledging the steps that they've taken, the first steps to actually talk about this issue. And I think from there it's really important that we give them a sense of hope and some of the knowledge around evidence-based treatments that we know are effective and can help people with gambling addiction, and also normalise some of those things that they experience associated with their increased drug and alcohol use or online gambling that they might feel a strong sense of shame or guilt about. So I think that's a good starting point. And perhaps Jane, and I know has a lot of experience in the area of engagement, would like to add some comments. And I know Alex is very knowledgeable about online gambling, so perhaps I'll hand over to you two to offer some comments.
I think, one thing here is to look at what people can do to sort of keep their own gambling where they want it to be, so setting limits and things like that. That's I think one side of it, but I think there's a broader industry-wide issue here. If we only look at the individuals and what they're doing and how we can change that, then that's only part of the issue. So consider things like the rampant amount of advertising that's available, right? It completely normalises gambling, and while we reduce exposure to the kids for that sort of thing, we know that young kids are talking in the playground at school about the odds for the upcoming footy match on the weekend as a way of working out who's going to win. So, we have a really strong gambling culture in Australia, and that kind of feeds into it. So changes there around the way we perceive gambling as a whole would be a really good start, and, minimising the amount of advertising around would be really good. Things like keeping a bit of a closer eye on what the operators are doing would also be a pretty good thing. So, for example, if you look at some of the reporting on ABC from people like Steve Kinane, who's done some fantastic work with operators, looking at what they're doing, with say, online sports betting or race betting, for example, those operators will cut you off if you're winning or not send you promotions anymore. So it's not a fair playing field. They're quite happy to take as much of your money as they can when you're losing and won't cut you off, even if they should. Whereas when you're winning, they're very happy to say, you know what, we're making a business decision to say you're not allowed to gamble with us anymore. So I think, those are just some of the broader issues here. Certainly in terms of online gambling, reducing access through things like credit cards would be a really good thing, requiring you to use debit cards or bank accounts instead. And, at least not betting on credit would be a good start, and potentially bringing in some form of pre-commitment, which is a bit of a dirty word. I get that. But saying this is how much I want to bet today. And once you reach that limit, then that's it. Even if a great betting opportunity comes up, that's how much you said and everything there. Because I think it's one thing to expect us in control of our gambling. People kind of don't understand that with gambling. They understand with alcohol that there's a substance in there which makes you feel good. So people get that alcohol gets out of their control because something makes them feel good. The same is the case with gambling, but people don't get that as much. There's often this, why don't you just stop? So there's a bit of a misunderstanding around people being able to keep their gambling under control because these products are addictive. There's a reason that we call it an addiction. So when you're dealing with something that's addictive and you're the one who's required to keep your gambling under control, but they're allowed to make the products as addictive as they want to, there's a bit of a problem there. So I think, looking at the ecosystem as a whole, not just the gambler's behavior, but the operator's behaviors, the products, the way you pay, the way they're advertised, all of these things need to be considered when we consider harm reduction. And this is both for online and for venues too.
So I think as Dr. Russell was just suggesting that gambling doesn't just occur as an isolated event or behaviour, it really relates to a range of things that are going on in that person's life, including the environment and issues like isolation and COVID restrictions, but it also relates to other comorbidities that perhaps exist in a ongoing way, untreated, and where people haven't sought help. So we know that there's very strong comorbidities in problem gambling, between problem gambling and suicidality, stigma, feelings of guilt and shame, past trauma histories, coping through use of increased drug and alcohol misuse. And we know that there's very strong correlations between use of alcohol and decreased capacity to exercise good judgment and to exercise control over our behaviour and choices. And we know the use of psychostimulants has a very strong correlation with relapses and relapses in problem gambling. So we know that isolation and that sense of boredom and frustration and financial stress and relationship stress, as we mentioned earlier, can trigger some of these other comorbidities. And really, if we want to engage with people to effectively treat their gambling behaviour and help them regain control over their choices and their responses to triggers, we also need to effectively treat some of these other comorbidities. And I think that, for example, if somebody has a current alcohol misuse problem, and then they effectively need to find some treatment for that prior to successfully or effectively engaging in problem gambling treatment. So we know that CBT, cognitive behavioural therapy, relies upon people learning new skills and practicing strategies and developing ways of reprogramming their thinking and responding to stimulus or triggers in a different way rather than past patterns of behaviour and maladaptive coping strategies that may have developed in response to some of these triggers. So it's very important, for example, to control your methamphetamine use or your alcohol misuse prior to or in conjunction with seeking treatment for problem gambling. Now, having said those depressing kind of facts and spoken about those, I think it's important that we understand that there is very good research and very effective treatments available for all of these issues. And it's a question of making sure that people really have effective treatment of these issues to maximise their potential for longer term recovery and minimise lapses and relapse. So, for example, if we can treat someone's past traumas effectively and help them develop skills and strategies that help them process and cope with those experiences in a more effective way, they won't engage in so many patterns of maladaptive behaviour to help them cope. We know if we treat somebody's dependency on alcohol, that will enable them to engage more effectively in therapeutic processes that require active learning and practice of skills in order to develop to the point where they become effective, or engaging in new ways of thinking through increasing our self-awareness and practice using cognitive strategies to develop new patterns of thinking in response to certain stimulus and triggers that may exist for those individuals. So, I think it's very important to ensure that people get the message that there is effective treatments and there is hope, and long-term treatment might mean reflecting on more than just your gambling behaviour. It might mean reflecting upon your mental health in a more general way and addressing some of these underlying issues that have existed for some time.
I'd like to talk about, I see a lot of clients and particularly 18-year-olds who try really hard not to gamble and they block themselves, but I just think people need to be aware and prepared that although the clients that I speak to have blocked themselves as a means to stop the harm, is that they receive emails to say, well, we've noticed you haven't been here. Here's an extra $1,000 of online credit that you can use, and we've got somebody here to help you get started again. So I think we really need to educate people to expect these kind of emails that will entice them back despite having blocked themselves, and really making a commitment to stop gambling. Sometimes when people get these free credits thrown at them, it's very, very hard for them to resist that hook to go back to gamble. So we really need to teach people to be prepared for these kind of lures back to gambling, and have strategies in place and supports in place. And like Dr. Black said, money management in place so that the harm can be reduced and they've got the ability to not engage in these ways of being pulled back into gambling.
I think one of the things to remember is that you're at the coalface, right? You deal with the people who are experiencing problems and the people who are willing to come and seek help, because that is a large barrier for people to get through. We know that of everyone who is classified as a problem gambler, so at the really pointy end of the spectrum, that only a very small percentage of them are willing and able to seek help. And it usually requires some kind of crisis moment. So by the time they're seeking help, it's often already too late. I think it's also worth pointing out that there's a lot of evidence now that there are lower levels of gambling harm that we're increasingly aware of these days. So, not everyone goes bankrupt because of gambling. Not everyone, commits crime or tries to commit suicide or those sorts of things. But there are lower levels of risk. So things like missing family gatherings or missing the rent occasionally, or those sorts of things that kind of kick in. They might only happen from time to time, but that's still a harm to somebody. And we should also point out that harm happens to people around the person who's gambling and experiencing harm there too. So I think a bigger picture of what this gambling harm looks like at a community level, and understanding that when we think about people who are experiencing problems, that is a very small amount, but that is the real pointy end of problems, and there are these lower levels that we should be a bit more proactive in terms of heading off. So there's a nice metaphor that I think he's professor now, Associate Professor Charles Livingston, I think, uses, which is, imagine that there's a cliff that's dangerous and it's dangerous. You can tell people not to go near the cliff, but it's got a beautiful view and you're going to go there anyway. So you can either put a fence at the top of the cliff and stop people experiencing harm in the first place, or you can just put an ambulance at the bottom. So they've already experienced the harm and you just try and make them better. At the moment, we work more on the ambulance side of things, whereas maybe we should be looking at fences a little bit more.
That's a fantastic metaphor to end with today. Thank you, Dr. Russell. We've come to the end of our podcast, so I'd like to thank once again our guest speaker, Dr. Alex Russell, as well as Dr. Jane Oakes and Dr. Quinton Black. Thank you as well to our listeners for tuning in. And don't forget that next week we will have another podcast on sports betting. So tune back in to hear more.